Hello, hello, hello. This is Dr. Grace. How are you guys? It is time for Medical Monday. Yes. It is Monday, June 4th. Can you believe it? It's already in the 6 month half of the year. I know it's kind of like a glare behind me. Maybe I need to fix this just a little bit. This is going to be on brain health part two. I did part one and I got an overwhelming response from this. So we're going to do a part two. So I need you guys to get on and invite you. I know it's beautiful outside. You guys might be out doing a walk. Hey Maria, thank you for joining on, Maria Manrique. Thank you. The first one for Medical Monday. I think I might have to, with this beautiful sunshine behind me. Hopefully it's not too much of a glare. I need my director daughter to tell me what she sees behind me. Hey, Sister Doris, thank you for chiming in and chiming on. I know sometimes my daughter was like, Mom, there was too much ceiling. Adjust the camera. So now I think it's going to be this glare behind me from the beautiful sunshine from this evening. So hopefully that you guys will be able to see. I'm Dr. Grace from the Metro Detroit area managing owner of Bethesda Holistic Center, undergirding everything new. New alternative regenerative medicine. Yes, we're doing some behind the scene things, and I'm really excited about those things. But tonight is going to be about brain health part two. Before the holiday, I did part one, and my goodness, it was a lot of people chiming in. Hey, Tanisa, tell me how my background is. Hey, Phyllis R. I'm kind of like the glare that's back there. Is that too bad? Is my head blocking it? Is it blurry? Can you see me? Let me know so I can make some adjustments, please. My daughter went to film school and graduated from Specs Howard University, so she's real good at directing and editing and taking pictures and all that good kind of stuff. And I thank God for her. So let me know what you see. Hey, Marita, thank you for joining on. Please like, invite, and share as you guys come on. Sharing is caring. And do your daily evangelism. Share, share, share. Like and share. Um, we appreciate you guys joining on. I am an MD. I'm a medical doctor. I've done all my training here in the Metro Detroit area. I went to Grace Family. I did my schooling at Wayne State University. We're one of the top medical schools in the country, and I did my camera screen is blurry. Okay, maybe it's dirty. Let's see what we got going on here. Is that better? Hey, is that better? Ooh, I don't know what that was on there. My G baby likes to play with my phone, so no telling what that was. Is that better? Um, Good. How about the glare behind me, Tanisa? Is the glare too bad? Is my head blocking? Is my head big enough to block it? But anyway, I did all my training at Wayne State University Med School, and I did my residency at Grace Family Practice on Wayne State University / DMC. Yes. And I have my business now that I work 100% for myself now, where we bring the doctor's office to the home for concierge services. Those are people that pay cash for our services. And for those that are sick, shut in, and disabled, where it's a taxing effort for them to get out of the home, we bring the doctor's office to them. We also do what we call health mapping, where we actually help you where you are right now today in your health and to help you develop a process where you want to be in your health. You should always be looking to improve yourself in some type of way from the inside out, which we believe. And for sure, I'm going to give a plug for my spiritual mom right now, and Dr. Beverly Y. Jackson. First of all, I want to give honor to God and give honor to our Apostle Wayne T. Jackson, and to my spiritual mom, Dr. Beverly Y. Jackson. She is having a women's conference this week called Whole Heart Ministries, and it's going to be about emotional stuff, heart stuff. You guys, if you've been following me for any length of time, that's right up our alley, right in the vein, because most sicknesses, infirmity, and disease are dealt with mental and emotional states. So on June 7th, 8th, and 9th, Thursday night, Friday night, and Saturday at 12 noon. Come out, ladies. Come and join us, please. come and join us for the Whole Heart. It's going to be a powerful time. There are going to be workshops and classes on Friday during the day, but I think registration is over now. So I want you guys to come out. I've been posting it on Facebook and sharing the postings that she has been sharing about her conference. So hopefully you guys have registered, and hopefully I'll see you on Friday. I took the day off to be there, so and I'm going to be there every night. Thursday night, Friday night, Thursday and Friday night, and Saturday. So please at 12 noon. So every night, Thursday night at 7 at Great Faith Ministries International at 10735 Grand River Avenue in Detroit, Michigan. So I'm inviting you out. This is a personal invitation for those of you who have been following me for quite some time. You know I pray. You know I believe in the Lord Jesus Christ. You know I'm Holy Ghost filled with evidence of speaking in other tongues. I would like to say some type of discernmentship. I do believe that I operate in the prophetic anointing as well. Under the tutelage of my spiritual mom, I actually took her class, and I flow in that almost every day in dealing with my patients. So I just thank God for the opportunity to do that. Hey, Pastor Joy, thank you for joining on. Please like, invite, and share as you guys come on. So I was sharing with those viewers that are getting on about the Whole Heart Ministry Conference that is coming up Thursday night at 7, Friday night at 7, and Saturday, our Sabbath at 12 noon. Please come out. Friday night is going to be preparing the heart to receive, breaking up that fallow ground, talking about hurts and pains and the emotional aspect of the heart being broken, and it's preparing the heart to receive the healing. And then Friday is going to be the deliverance, and Saturday is going to be the actual impartation. So Thursday night preparation, Friday deliverance, because once that vessel has been healed and cleaned, we want to make sure that it's filled with the right positive things with the Holy Ghost and the Word of God with power and demonstration. So that's going to be Thursday, Friday, and Saturday. So tonight what we're going to be talking about is brain health part 2, guys. I did not have any idea that, oh my goodness, that I was going to have the response that I had in regards to brain health part 1. And so I decided to do a part 2, and we're going to continue on. And guess what? When we were in service on Saturday, Apostle said out of his own mouth by the leading of the Holy Spirit that there has been a release in the earth regarding mental disease, memory loss, and that he wanted to pray for the people that were there on the Sabbath. And believe me or not, guys, I do have sometimes some cloudy times. And when I did my research on this brain health part 2, I have a better understanding of what was going on. And anytime that you feel that you have a challenge, you should never be ashamed or embarrassed to say, hey, and step out and say, hey, I need help. I mean, that's the only way that you're going to get better and get what you need, is first to admit that there is an issue or a situation and address it accordingly. So, Maria, please, I want to come out either Thursday night, Friday night, or 12 noon. I would love to see your face in the place. Every time I go to your mom's, I'll never get a chance to see you. Hey, Lisa, thank you for coming on. I appreciate you. As you guys come on, please like, invite, and share. I think I greeted everyone that is on thus far. I am simultaneously live streaming on excuse me, simultaneously live streaming on YouTube. So please, oh my goodness, what is going on here? Trying to reconnect. This is what it's saying on I'm not finished. So something is going on here with my connection with Facebook here. So let's see what's going on. Oh my goodness. Oh my goodness, my goodness, my goodness, my goodness. Trying to read. Due to poor wireless connection, your broadcast has been paused. Consider moving and finding a better signal. Okay, there we go. We're back. Hi. I don't know what happened there. But thank you guys. Please like, invite, and share as you guys come on. So we're going to be talking. One of the things that I want to talk about tonight is one of the things that I briefly touched on the last time we were on. I want to talk about dementia and Alzheimer's disease. And before I even go into that, I want to talk about a health revolution. I talked this about one of my marketing coaches, and He was like, Dr. Grace, you got to be careful with that, blah, 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 blah. But it's coming from the perspective that the revolution has to start with you. I've heard people that wanted to be so radical where they want laws changed. They want to go to the White House and have laws about what foods need to be out and all that other kind of stuff. People still want to do what they want to do, make choices, and be it good choices, bad choices in regards to everything in their life, including their health. So just because you make a law to change some things, that doesn't mean people are going to follow them. People still break laws to this day. So, but anyway, I had an epiphany, a revelation this week. I was out doing my home visits, and I needed to stop and get some water. And I went into a liquor store to get a bottle of water. I was kind of like way out on the outskirts, like close to the airport. It's almost like farmland out there. So that was the one of the. So I went in, and I walked in. As soon as I walked in the door, I heard clear as day, look around. So I stood there and I looked around, and it was from the floor to the ceiling, nothing but alcohol. And then when I looked to my right, there was a deli of processed meats. And then I looked ahead, and there were potato chips, there were cookies, cakes, candies, and there was just a small area with salad and maybe a couple of heads of lettuce and some tomatoes and cucumbers. Just one little section, but everything else was everything that I mentioned. And so I stood there for a minute and I was like, wow, this is amazing how that um, the store was just basically selling bad health. And I was like, oh my goodness, how many people come in here to buy what and to get what? And what is it doing to their bodies? So that prompted me to do a little bit of research. So my research was looking at how many liquor stores are there versus grocery stores in the United States. There are more liquor stores than there are grocery stores in the United States. Yes. There are more, it is a $54 billion industry in the United States. It makes more money than people buying food in the grocery stores. So, and then we wonder why that heart disease, dementia, Alzheimer's disease, cancer, cirrhosis of the liver, strokes, diabetes, is rampant in our nation. Look at what we're in. I mean, just look at everything that is around us. And if you watch regular television, you can sit there for a half an hour program, and it's really 15-minute program, and there's 15 minutes rest of advertisements or advertising, and most of it is about food and fast food. So we need to make up in our minds that we're going to make good choices in regards to our health every single day. So I've talked about this before. Even when you watch television, you can watch all those commercials. Then you get up and walk to the refrigerator, and you open the refrigerator, and you look in there, and you're like, "What do I want in here?" Guess what? You really don't want anything, but you just got finished watching all these commercials back to back that send you subliminal, subconscious messages about food. So now it triggered something in your brain about food. So you go to the refrigerator to eat when you really don't want anything. Yeah. So, but anyway, so I just wanted to give you that tidbit in regards to that. So we're going to take it a little deeper in regards to brain health part 2. So I did my studies as a doctor for the last 20 years, and I was thinking about the screening tests that we have available for our health. So when you go to the doctor and you get your vitals done, when you come to the door, you sign in, you sit down, they call you back. They take your blood pressure, they take your temperature, and they take your pulse, and they put the little thing on your finger to see how much oxygenation you have, and they check how many rates that you're breathing per minute. And there should be certain things done certain times in your life as far as screening is concerned, from a child all the way up, be it from immunizations all the way up until you make your transition from this side of heaven to the other side. Okay? So one of the things that I've noticed, we do maybe a neurological exam most oftentimes after something happens, but there's really no screening tool for your brain unless a person has a complaint, And then my question is, once the complaint is made, is it too late? And that's just a theory or theological question or a hypothesis in the science field in regards to that. So then, why is a memory important? Because we talked about that in regards to your mind. If you lose your mind, basically you lose everything. So it's very, very important that we have some tools, even as a provider, because I do have some providers hey Dion, thank you for joining on. I do have providers come on that may listen to my video from time to time. So what screening tool is out there that we can actually see the health of the brain? And the last time I did part one, I asked, how much would you be willing to pay for it? Because if it's not a screening tool that is used by the medical industry as standard, insurance companies are not going to pay for it. So let's go back to the liquor store thing that I was talking about. It's all about money. And it is the truth. I'm just speaking facts. It's all about money. So you got a liquor store industry that makes over $54 billion a year, that people buy liquor, buy all the cooked cakes, candies, chip, pop, processed meats that, to put in their bodies, that is doing some type of damage to the body. Then you go to the doctor, and then the doctor bills, and then people have heart attacks, strokes, and situations like that. Then they go to the hospital, and then they go to the nursing home. And then from the nursing home, they should go home and recover and do better. But I used to cover nursing homes. But I was told by one of my superiors that there should be a flow of the bodies, basically, through the system. And for some reason, it was not happening with me because, guys, I was actually taking care of my patients. Yeah, so the flow was being stopped and being hindered. But that's a whole nother story for a whole nother time. But let me take you where I'm going with this in regards to brain health. Number one, there's really no screening that takes place to see the health of the brain. Number one, until something happens, be it a stroke, or be it a person is having brain fog or memory loss or things of that nature, then there's some investigative things that could happen at that point. But there's nothing that is standard in the medical field or the medical industry that actually screens for how healthy your brain is at any time during your regimen as far as your health maintenance. Okay, so if any of you out there have had your doctor to say to you, or we're going to see how healthy your brain is today as far as your screening, let me know what it is and who's your doctor. I would love to know that, because I would like to get in touch with them to find out what they're using. So we're going to talk about dementia right now. Dementia is a syndrome, not a disease, okay? Dementia is a group of symptoms that affects the mental and cognitive tasks such as memory and reasoning, okay? And dementia is an umbrella term that Alzheimer's disease can fall under. So it can occur due to a variety of conditions, the most common, which is Alzheimer's disease. So dementia can also be what we call vascular. And I've talked about that when I talked about strokes. So that's blood supply being hindered to the brain tissue for whatever reason. Be it that a blood vessel pops because the blood pressure is so high, which we call an aneurysm, and the pressure is so high, and sometimes people have bubbles in their vasculature in their brains from birth and they don't know about it, and then they just randomly pop at a certain time. So that's called aneurysm. So when the blood vessel pops, the blood can't get to the tissue that it was going to, so the tissue behind that blood vessel dies. Or you can have what we call vascular, again, where a clot forms. And you guys know what a clot is. I mean, it's like a blockage. It's like, so the blood, a clot forms in that vessel, so it stops the blood flow going through that vessel, so the tissue on the other side doesn't get the blood or the oxygen that the blood is carrying to that tissue to live in the brain, so that part of the brain or that tissue dies. Then you have what we call hypoxia, which means for whatever reason a person stops breathing, be it due to a heart attack, drowning, um, carbon monoxide poisoning, fires, or whatever the case may be, where they're actually not picking up the oxygen that is being pumped through the heart to the lungs, through the vascular system to the brain, which can cause brain damage. Okay, so these are all damaging things that can happen. And then there are some natural processes that I'm going to talk about tonight that you probably rarely get a chance to hear about or know about, which is the Alzheimer's type. So I'm just going to talk about briefly 10 signs and symptoms of Alzheimer's disease. And just because you may have one or two of them, does that mean you have Alzheimer's disease? So don't be a what I call a hypochondriac and be like, oh, I have that and I must have Alzheimer's. No, don't claim anything. This is more an educational piece or tool for you to monitor yourself along with you providers that are watching, from other doctors, nurse practitioners, physician assistants out there that would, when a person comes to you with a complaint, please just don't poo-poo it off or blow it off. um, we really need to indulge and indulge that person, listen to that person, because even as providers, guess who's spending the more time with the patient? The patient. It's not us. The patients spend more time with themselves than we do. So we owe them to listen to them when they have a legitimate concern. So memory loss is what disrupts daily life. So one of the most common signs of Alzheimer's disease is memory loss, especially forgetting recent learned information. Others include forgetting important dates or events, asking the same information over and over again, increasingly needing to rely on memory aids like reminder notes, electronic devices, or family members, or for things they used to handle on their own. So, yeah, that's one of the things that you need to pay attention to. Challenge in planning or solving problems. So if they experience ability, now be mindful of the fact people with the beginning stages or Alzheimer's disease know that there's a problem, and they're willing to address it. Hey, Lynette, thank you for joining on. Please like, invite, and share. So so it is very, very important that people understand that it could be, if they're not have ability to work anymore. Remember addresses, phone numbers. Believe it or not, we're all brain lazy now because we have cell phones. So when we used to have to remember telephone numbers or have a phone book to write them down, everything now is in our cell phones. We type the number in and then we just push a button. So that really makes us really brain lazy. Even calculators and adding things up and things. Everything now is all electronic, which really makes us brain lazy. So is it truly memory loss, or is it really just being brain lazy? So you really need to make that determination in regards to that. So keeping track of monthly bills, difficulty concentrating, or take much longer to do things which they did before. These are that's number 2. Difficulty completing familiar tasks at home, at work, or at leisure. So people of Alzheimer's disease often find it hard to complete daily tasks. So what is a daily task? A daily task means, just getting up, going to do your daily hygiene regimen, washing your face, combing your hair, brushing the teeth, taking a shower, just using the bathroom. All those things are become a challenge because they don't remember what to do next. So, that's what I'm talking about as far as difficulty completing familiar tasks at home, work, or at leisure. Um, People say they'll get in their car and know that they're about to go to the store, and they can't remember how to get to the store, or they make it to the store and they're on the way home and they know they're way home, but they can't remember how to get home. So that is a huge red flag, and sirens need to be going off. And don't be afraid to say that's what's going on and to let someone know. Confusion with time or place. So they don't know what time it is, if it's day or night, or no, unless you're a doctor. or where they are right now. You might ask them, Mama, Dad, where are you? Well, I'm at home. And they're really in a nursing home, or they're at home and say they're in a hospital. Okay, that is confusion to time and place. But if you're a doctor or a resident, that doesn't mean you have Alzheimer's disease. So I'm gonna tell you the story. And then for you doctors that are out there and you've been on call, you've done this before. And if you've never done this, I would refute whether or not you're a doctor or you ever did residency. So you would be on call, and you'd be on up all night, and then you would leave the hospital and go do clinic after leaving the hospital from being up all night. Then you leave clinic maybe 3, 4 o'clock, 5 o'clock, and then you go home and go to sleep. Or you don't do clinic, you just leave home and you have the day off and you go to sleep when you get home. And then you wake up because you done slept 8 hours and it's dark outside, and you wake up and you're like, oh my God, it's 9 o'clock in the morning, and it's really 9 o'clock at night, and you're rushing around and you're getting dressed, you're getting your breasts, running, put your clothes on and everything. You're like, oh my God, I was on call all night. It's really 9 o'clock at night, really not 9 o'clock in the morning, especially here in Michigan when it's winter time, when it's dark when you wake up and dark when you go to sleep. So we're not talking about that right there. I think that's a little bit funny. That's happened to me a few times as a resident. But anyway, we're not talking about that. Trouble understanding visual images and spatial relationships. Now, this is something that doctors should be doing, or you doctors should be doing with your senior patients and with your elderly patients, or anyone that are complaining that they're having memory loss and confusion. So we learned this in medical school and learned it in residency. You would have a person to draw a clock. So in Alzheimer's disease, they're unable to draw a clock 12, 1, 2, 3, 4, 5 around the face of the clock. Sometimes they'll have the numbers all on one side or things of that nature, and understanding visual images. So for some people, having visual problems is a sign of Alzheimer's disease. They may have difficulty reading, judging distance, or determining color or contrast, which cause problems with driving. Number 6, new problems with words in speaking or writing. People with Alzheimer's disease may have trouble following and joining a conversation. So they kind of like isolate themselves, draw back. They struggle with vocabulary, have problems finding the right word, or calling things by the wrong name. So, and I'm not talking about mispronunciation of a word. I am talking about saying a clock is a mirror, or a clock. Well, not saying that, some clocks do have mirrors behind them, but actually calling a pen a toothbrush, or really having problems identifying an object and calling it the correct thing. Sometimes it may not only happen in Alzheimer's disease. This can be post-traumatic brain stress, be it from a stroke or even trauma. So those things that I talked about earlier, from a clot, bleeding, and tissue damage, that also can be from blunt trauma or trauma to the head or closed head injuries as well. Number 7, misplacing things and losing the ability to retrace your steps. Now, I'm not talking about if you're able to retrace your steps. Okay, I know I put this in here. Now, if you have a grandchild, which had happened to me last week, a 2-year-old, okay, I'm rushing to come into the house with her. And you all have experienced this when you get home. You got to go to the bathroom. You got to go to the bathroom. So you put everything in one place, and then you come back and I'm like, okay, I know I put my keys here. I am retracing my steps to find my keys. And guess what? The little one was helping me look for the keys. She was like, when I opened up the door, because it was under my, one of my closets have a little space because it's a sliding door. I said, well, maybe it slid under there. So I opened the door. She in there looking with it for me and everything. So I'm walking through the house. I was like, I went there. The keys not here. I was like, they're not in my pocket. I looked in my purse. I was like, I know I had to I opened the door. I was like, maybe I left the keys in the door. So I grabbed her hand, and it was nothing but the Holy Spirit said, she took your keys. So I grabbed her by her hand and walked into the family room, because that's which way she went. And I said, show me where you put the keys. So she has this cute little table where you can take the lid off and put her little toys and things in there. So she took the lid off and said, there it is. She took the keys and hid them from me. So I thought I was really having a senior moment. I thought I was having a little touch of dementia and Alzheimer's disease because I knew I had them keys. So in that case, I thought that would be a cute little story to throw in there. But I really was having a moment. I was like, maybe I did forget, maybe I didn't have them, but anyway, I'm not talking about if you can retrace your steps. I'm talking about if you misplace something and you're unable to retrace your steps. That is a big issue. All right. Decrease or poor judgment. People with Alzheimer's disease may experience changes in judgment and decision making. For example, they may use poor judgment when dealing with money, giving large amounts to telemarketers. They may pay less attention to grooming or keeping themselves clean. Those are all brain demise, brain things. That's why scammers prey on the elderly. Hey Debbie, thank you for joining on. Hey Maisha, thank you for joining on. Please like, invite, and share. So, even when I go see my seniors in their homes, the phones are ringing off the hook. Their cell phones and their landlines are ringing off the hook with all these telemarketers. I had even a senior today was explaining to me what was going on with her, and like I could really do something about the people that were calling her. I was like, okay, what can I do to help you with this? I'm the doctor, I'm coming to see you, but I have no control over who calls you. I wish I did. But maybe I need to look into that, because every solution to every problem can be very lucrative. Let me say that again. Every solution to every problem can be very lucrative. So maybe I need to figure out a way for all these telemarketers and these scammers to leave these seniors alone. But anyway, that's why they prey on them, because they know that elderly people may be dealing with poor judgment because of their age and maybe some type of brain disease that they may be dealing with. And I'm about to give you guys some stats in a moment in regards to that, in regards to the brain thing. Number 9, withdrawal from work and social activity. A person with Alzheimer's disease may start to remove themselves from hobbies, social activities, work projects, and sports. They may have trouble keeping up with favorite sports team, remembering how to complete a favorite hobby. So you have that, if you have that G-mom or grandma who likes to needlepoint or like to crochet or do some things, if it's not due to arthritic or something going on with their hands and they're not doing it anymore, that's a sign. You really need to investigate that, okay? Or hobbies that that they love, or soap operas. They're not talking about them anymore because they can't remember them. Those are red flags. Sports, especially the gentlemen, they talk about sports all the time, their favorite team, and they're not talking about them anymore. You really need to look into that. Number 10, changes in mood and personality. A mood and personality of people with Alzheimer's disease can change. They can become more confused, suspicious, depressed, fearful, and anxious. And in some cases, they can become violent or combative. Yes, they can. They may be easily upset at home, at work, friends, places where they are out of their comfort zone. So most oftentimes, people that deal with people with Alzheimer's disease or some form of syndrome of dementia, moving them from place to place can be very traumatizing to them. Hey, Charmaine, thank you for joining on. Please like, invite, and share. Hey, Larry, thank you for joining on. You really need to do some investigation on what's going on with them. What is the difference between Alzheimer's and typical age-related changes? You need to be able to do that as a provider, even a caregiver, because we do have a lot of people now that are taking care of family members. So signs and symptoms of Alzheimer's and dementia is poor judgment and decision making. And in typical age-related changes, they're making bad decisions once in a while. Like Pookie, Ray Ray, and them calling and asking, can I have $20, $30? And then the next time it's $100, $300, and they give it to them. Nah, and it's once in a while. We're not talking about that. It's like they're doing it all the time. Okay, so we need to talk about that. And they know they have bills that are due. Inability to manage and budget. That's signs of Alzheimer's disease and dementia. And typical age-related things, they may miss a bill or two, because You know, some of them, you know, write everything out. I know a lot of them are not computer savvy, so they're not paying bills online. You know, they might miss a bill or two or whatever on occasion. So that's age related, but it's not Alzheimer's or dementia. Losing track of date or the season. So if they are saying that, if you ask them what year it is, Grandma, and you know it's 2018, and she talking about it's 2009, that's a sign of Alzheimer's or some type of dementia. Sometimes forgetting which words to use, that could be age related. Forgetting what day it is and remembering it later, that is age related. You know, I mean, sometimes I have to get up in the morning and I sit there for a minute. What day is it? Because these days are going so fast and my life is going so fast. I gotta ask myself what day it is when I wake up. So that's, you know, when I was younger it really didn't matter, but anyway, but that could be age related, not a sign of Alzheimer's or dementia. Misplacing things and being unable to retrace your steps to find them, I just said that. The signs of Alzheimer's disease or dementia. Or typical age related changes is losing things from time to time. Okay, so you know, with all the stuff that's on television, you know, with grandma or auntie or your godparents or whatever who you're providing care with, kind of reassure them if you are picking up it's just due to the fact that they're getting younger and younger, or it's actually a disease state. Okay, you want to make sure that. Now let me tell you this. Listen to this. Listen to this. All right, I'm gonna tell you. About to give you some numbers in a minute. So let me read this to you first. Causes and risk factors. Like all types of dementia and Alzheimer's disease, is a cause of brain cell death. It's a neurodegenerative disease, which means there is progression in brain cell death that happens over time. In a person with Alzheimer's disease, the tissue has fewer and fewer nerve cells and connection. So what happens, remember when I talked about the mind and the brain before? When you have positive thoughts or negative thoughts, brain cells are being made and chemicals are being released. So when you think positive thoughts, you create brain cells that release positive chemicals. Or if you have negative thoughts, you're creating brain cells that release negative chemicals. So what's happening in this state, these cells that you have there, or a person may have, they are actually dying. And they can be dying for a number of reasons. We talked about that already. Vascular dementia, because they're not getting the blood flow that they need because blood vessel ruptures, or there is a clot, or their breathing is not, the blood is getting there, but it doesn't have the oxygen that it needs for the tissue to live. Or there is actually what we call brain plaques. Yes, there's a thing that's called brain plaques. Just how you can get plaques throughout the arteries from high cholesterol. There is what we call beta amyloid, which can be found in the brain, and most oftentimes is found in the brain after a person has died from Alzheimer's disease by dissection. So my question is, if you know it's there after a person is, you know, made their transition, and we have tests and things that are available to test levels of cholesterol, where are the mechanisms and the testing in place to test for brain plaques? There are millions, almost billions of dollars going into research for Alzheimer's disease. But it's more so on the side of formulating pharmaceuticals to give to a person to slow down the progression of Alzheimer's disease. But there's really nothing on the preventative side to say, hey, we need to be doing something earlier in regards to the prevention of it. So scientists are not absolutely sure the cause of Alzheimer's disease, but plaques or triangles are prime suspects in the death of the cells of the tissues of Alzheimer's in the brain. And the plaques are normal clusters of chemical sticky proteins called beta amyloid, which I just said, which build up between the nerve cells, which makes sense. So you have nerve cells, they connect, and it's like a long extension cord or a wire. So the cells connect, they release chemicals to the next cell to talk to it. So that's how the brain operates. So the sticky stuff, as the cell dies, it kills the cell. So when, let's say, let me use these three fingers here. So you have this brain cell trying to talk to this one. This one dies, and it's the sticky stuff. So when it's trying to send a signal to this one, it's disrupted. So your brain is like an electrical system. So the question then becomes, if you know this is the cause of it, what can we do to prevent it, right? So that's what research is all about. But I'm going to read you something that tells you that builds up these proteins in the body. Okay, this is from Harvard Medical School. I love to read about their research and the things that they're talking about in regards to plaque. But I want to read this to you right now. Now, remember I told you about when I walked into that liquor store, what I saw. Not only saw liquor, but I saw a deli with processed meats and all the Cook's candy, potato chips, and pop, and all of that. Listen to this. Scientists have proven that the foods that build up proteins in the body that have been associated with Alzheimer's disease are processed meats, lunch meat, any processed meats, right? Such as bacon. Oh, I used to love bacon. The thick cut kind. Yes, I did. I used to buy it by the pound. Yes, I used and have it cooked up for the week so it could be in my refrigerator. Part of my paleo high protein diet food choices. Yes, I used to love me some bacon. I'm being transparent. You looking into dark. I still love some bacon, but I'm not eating it. I made a conscious decision and choice. Even though I love it and like it, I don't eat it anymore. Okay, such as bacon. Listen to this. For you turkey eaters out there, smoked turkey from the deli counter and ham. Smoked meats like those contain nitroamines, which cause the liver to produce fats that are toxic to the brain. And then they also talk about beer. And increase that sticky protein that is built up in the brain that causes the plaque for Alzheimer's dementia. So those are the things that have been associated with that, okay? So in my research today before coming on, hey Kimberly, thank you for joining on. Not sure the bacon. You must like the bacon too, Kim. Chosen Earl, thank you for joining on. Thank you joining on. Please like, invite, and share, guys, as you guys come on. So now, in my further research too, because you guys know I did a whole video on the proper way to sleep. You know, you just think you should just go to bed and go to sleep, but I did a whole video on the proper way to sleep. And guess when that protein is clean from the brain? When you're sleeping. So there's a process. Oh, yeah, Maria, goodbye, bacon. There's a process when you're sleeping. Your body cleans out that amyloid, beta amyloid. But if you're not getting enough sleep, that process is not taking place. So it is very, very important when we say that you need anywhere from 6 to 8 hours of sleep a night. That is very, very important. So the less you sleep, the more you eat. Remember I said that? So the less you sleep, the more you eat. More you eat the wrong thing. And the less you sleep, the less the process of the brain detoxing itself. So sleep is very, very important. Yes. Okay. So let me go to this Harvard study here that I was talking about earlier, plotting the demise of Alzheimer's disease. One of the things they say, of course, first weekly series of Harvard researchers are tackling the problematic issue of aging. They say the best thing to do is catch it early. In my mind and my heart is, instead of catching it early, I think you should eat right. Your food should be your medicine. You should eat to live and not live to eat. So, yeah. So, so that will surmise a whole lot of things. Now, listen to this. Those are watchwords in the battle against of most illnesses, such as heart disease, which we talked about, cancer, type 2 diabetes. Early detection gives a physician a chance to minimize damage, to insert stents to keep blood flowing to the heart, to remove tumors before they become many, or urge crucial lifestyle changes. lose weight, eat better, and exercise. So that's not just for heart disease, diabetes, that's for your brain health too. All right. So they're trying to make sure that they implement the same processes for your brain and to keep it healthy. So that is the reason why at Bethesda Holistic Center, we're really looking, if you looked at the picture for the event for the show tonight, this lady, the black lady, had this little thing on her head. Those are electrodes that we connect to a computer, which allows us to detect your brain waves, the nutrients of the brain, and all of that. So we're really strongly considering taking on this type of testing in our practice. But again, it is not mainstream. On the natural health side is mainstream, but it's not mainstream in the allopathic side of medicine. Because if that be the case, all of you under the sound of my voice with healthcare insurance would have had a brain scan to test your brain health, not a CT scan or MRI after something has happened. All right. So I also posted a video on Medical Monday from Harvard with a Harvard University professor talking about her personal experience with Alzheimer's disease, dealing with her dad and her father. So it's really good if you guys can go there and look at that video, because I thought it was very heart-touching and warming to see that someone that is in the industry that is working towards brain health because of what she had to deal with dealing with with one of her parents. So I talked about what are the things that are not good to eat in regards to your brain. Yes, smoked turkey, Debbie. And most oftentimes what we do is we use smoked turkey to flavor our vegetables for those who are going the healthy no meat route or eating more vegetables. So yes, the nitroamines in the smoked turkey is what causes the beta amyloid production to increase, and also to cause the brain plaque in the brain. So something that we figure that we're doing healthy really is not. So you heard it here. Medical Monday from Dr. Grace. All right. So the things that you can eat that are healthy for you, one of the things they talk about is wine. And I know a lot of you under the sound of my voice are saved, sanctified, filled with the precious Holy Spirit. And there's a debate in Christendom and in the kingdom in regards to wine and drinking wine. The Bible talks about drinking wine. That was one of Jesus' first miracles when he told his mother, "Woman, what do I have to do with thee, for my time has yet come?" He changed water into wine at a wedding that he was at, that Jesus used to drink wine. But anyway, that's a whole nother story. But wine is good for the belly. But we're not talking about being drunk with wine. We're not talking about hard liquor. So I want to be careful when I say this as a kingdom representative, an ambassador for Christ. I am not talking about getting lit. That's not what I'm talking about. I am talking about from a Harvard study that says wine helps balance out or decrease the cause of brain plaques. Now, if you're someone under the sound of my voice that have issues with alcoholism or an ex-alcoholic, please do not use this as a reason to start back drinking, because that's not what this is about. All right. So, and we're going to talk about drinking and brain health in just one moment. It's 8:48. Oh my goodness, I got to hurry up. Wine rounds out at least 10 brain healthy food groups that help protect against Alzheimer's disease. So you want green leafy vegetables, other vegetables, nuts, berries, beans, whole grain, fish, poultry, olive oil, and wine. And I'd like to talk about good oils here. There's other good oils besides olive oil that you can use. So flaxseed, omega-3, krill oil, avocado, those are good oils, and they're good for the skin and the brain. Now, here we have 5 food groups it says you should avoid to reduce your risk of developing dementia. So I kind of went over that with you already. But I want to talk about alcohol. No, let me read this right quick. I just said that. the foods, the omega-3s, the leafy greens, what they call cruciferous vegetables. That's your broccoli, cauliflower, bok choy, Brussels sprouts, kale, contain folate that have carotenoids, um, in it that helps with brain health. Okay, they lower homocysteine, which is very an amino acid like for cognitive impairment. So you definitely need to that. Beans and legumes. I just talked about that. Whole grains, berries and cherries. I love cherries. Antioxidants. They help with anti-inflammatory. So you want to get rid of free radicals. So your vitamins that help get rid of free radicals is vitamin A, C, and E. Pumpkin, squash, asparagus, tomatoes, carrots, and beets. Beets is very, very good for brain health and nitric oxide production, which helps vasodilation for your vessels throughout your body to help increase the blood flow to the brain so you can have a healthy brain. Omega 3s, again, we talked about the oils, flaxseed oil, olive oil, not safflower. That's safflower. We're not talking about that. But the ones that have the good omega-3 fatty acid, almonds, cashews, walnuts, hazelnut, peanuts, and pecans. Now, I have a problem with that because as a small child, I was have a known had been diagnosed with allergies to those. So I have to get my vitamin E and folate, B6, and magnesium from other sources. Okay. Let's see here. Sunflower seeds and pumpkin seeds. I do eat those. Cinnamon, sage, turmeric, and cumin. Those are my favorites of the favorites. Remember that show that I did that you have medicine in your spice cupboard? I did that. That was one of my first Medical Monday shows. I don't know if you guys remember those. Hey, Sister Gwendolyn Snow. Hey, Nurse Snow. Thank you for joining in. I actually did a show where I did through the spices that are in your food that you cook with, that's in your kitchen, that can be medicinal to your health. So cinnamon, sage, turmeric, and cumin. These spices all help to break up brain plaque and reduce inflammation of the brain, which can cause memory issues. In addition to eating the foods listed above, you want to decrease the risk of illness that can make your brain age, such as obesity, heart disease, diabetes, and hypertension. All of those go together, what we call metabolic syndrome, which can also increase bad health for the brain. Other things to avoid are toxins in your food. Water, soil, and environment. Unnecessary stress, caffeine, sugar, drugs, alcohol, and sugar. You need to avoid those. Encourage healthy decisions, conscientious, positive peer groups, clean environment, exercise, maintaining healthy weight, 8 hours of sleep, which I already said, stress management, and gratitude. Remember, I did like a whole show on being thankful, being gratitude. So you got to make sure that you incorporate all of this. So we're going to talk about alcohol right here at the end of my show. It's 8:53. Any comments? Love cherries too. I'm gonna go back and kind of scroll back a little bit in a minute, but I want to talk about alcohol and confabulation. I remember talking to my mom about this because we do have some family members that used to have alcoholic issues or alcohol problems, and it's this one family member that calls her all the time, and she was like, he tells me these stories and he acts like they really happened and they were true, and none of that stuff is true. And I was like, Mom, that's called confabulation. And what happens after a while from a person drinking alcohol for a very long time, lengthy time, it does damage the brain. It causes deficiency in certain vitamins, and thiamine is one of them, B1 vitamin. And if a person is, and some of you under the sound of my voice is like, why do cousin so-and-so or auntie or Junebug or whomever, I'm just making up names, I ain't talking about nobody, why when they drink, they tell all these stories and none of them true? That's called confabulations. That is one of the nutrient deficiencies that's from alcoholism that damage the brain, which is thiamine deficiency, which we call, what we do in the emergency room, we call it a cocktail that we give people that we find unconscious that smell like alcohol. We infuse them with a cocktail that that reverses if they're on drugs. We make sure thiamine is in there because it bounces them back or whatever the case may be. So it's called Wernicke's Korsakorf. Yes, that's a such word, which is a damage to the brain for chronic alcohol use, which from a thiamine B1 deficiency. So there's more than one reason why a person can have dementia. And we talked about vascular, but we can also talk about toxic and drugs. Alcohol and drugs can be damaging to the brain tissue. So some things from alcoholism can be reversed and some things that cannot with drugs too. But I do believe in the all-powerful almighty God who can do anything and nothing is too hard for him. So, but you have to put yourself in a place to receive what God has for you by making good choices. So hopefully what I said tonight, I said a lot. And I know most hopefully times I do say a lot every show. It is 8:55. So it's Medical Monday here in Detroit, June 4th. Can you believe it? What I want you guys to know, I really am considering getting this device, and I'm going to be using it in my practice because, like I said, I did not know that I was going to have the overwhelming response from part 1. So for those of you that are under the sound of my voice, oh, let me see. There's something else that I need to, within this next 5 minutes. Hold on, listen to this. Before I'm gonna close the show with this, and I want you to listen to what I'm saying. 10% of Americans over 65 years of age, that's 5.1 million individuals, suffer from Alzheimer's disease. That is a staggering amount. Listen to that. 10% of Americans over the age of 65 years old of age, that's 5.1 million individuals suffer from Alzheimer's disease. Now, remember I told you when I started the show that there are more liquor stores than there are grocery stores. And liquor stores generate $54 billion a year, which is more than the grocery store industry. And remember what I said in most liquor stores? And I told you what liquors do to the brain. And I told you what processed food does to the brain. My internet connection right now on Facebook is spinning around right now. So hopefully I'm not going to touch anything. Hopefully I can reconnect to finish the show. Hopefully I can reconnect to finish the show. Trying to reconnect. Okay, I'm back. I had an interruption when I said that. I'm going to say it again now. That I said at the beginning of the show that there are more liquor stores than there are grocery stores in the United States. And the liquor stores generate $54 billion a year. It's a $54 billion industry. So, but 10% of Americans over the age 65, remember what I said was in liquor store, the liquor, and I just told you what liquor does to the brain. And there's cookies, potato chips, pops, and processed meats in most liquor stores, which contributes to poor brain health. So listen to this, guys. By 2050, we are already at what? 2018, almost 2020. So in 30 years, about in 30 years, aging baby boomers will cause this numbers to reach 16 million. So by 2050, there are going to be 16 million Americans. If we don't get a handle on this brain health and keeping our brains healthy along with everything else, that are going to have Alzheimer's disease. So I need you guys to commit to this health revolution, self-help revolution, that from this day going forward, from this time that you hear this video, that you're going to make a conscious decision to make good health choices. Now, before I leave, I promised someone that I was going to say this. we have some faithful medical Mondayers on here that hear everything that I'm saying. And this, she did it and she was like, it worked. I was like, yeah, you didn't think it was. So she said, you know what? It's not that I didn't think it was, that I forgot. So it's appropriate with the show to talk about the things that I tell you guys. The videos are uploaded on the Medical Monday page. The videos are uploaded on YouTube. You can go back and review. Not only that, how about contacting me so we can do a health map for you, a personal tailor-made health map for you, for whomever, so we can get you on track and stay on track in regards to your health. So I am Dr. Grace. It is actually exactly 9 p.m. on Monday night. So next week, we're going to do another show on Medical Monday. So stay tuned for the next topic. I will create an event page. I'm going to scroll down and see if there's any comments that I can. Great stuff. Thanks. You're more than welcome. You guys are more than welcome. I appreciate you guys tuning in. Please share this video. Please get the word out. This is really, really serious. 16 million Americans by 2050 will have Alzheimer's disease, and it's because of our eating habits. And there's really not much research on, except for medication on to slow the progression, not actually for cures or prevention. So please, 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 please share this video. I am Dr. Grace from the Metro Detroit area, native Detroiter. My office is at 2141 Civic Center Drive in the Enterprise Building, Suite 102. Our telephone number is 248-356-1111. That's 248-356-1111. Our website is www.bw-center.com. That's how you can get in touch, or message me. And then I can send you a link on how to make a, even if you're across state lines, I can do a concierge services for you over the phone, video chat, however you see fit, because you're worth it. All right. Thank you, Trina. Thank you for joining. Please like, invite, and share. Please share this video. Please make it go viral. People need this information. They need to know. They need to know. They need to know. They need to know. Because what happens with Alzheimer's disease, a person loses themselves. They're able to walk around, they're able to talk, but they lose themselves. And for the family member, they lose somebody. It is nothing like seeing somebody that you know that don't know you. Could you imagine that? Your mother that carried you in her belly for 40 weeks. And raised you, changed you, kissed your boo-boos, went to all your graduations and all that other kind of stuff. And you walk in a room and she's like, who are you? Baby, I think I know you. That's horrendous. And then the person themselves, knowing that in the tormenting part of Alzheimer's disease, the person themselves know that something is going on and that's wrong with them, and they can't do anything about it. And they're in and out. So please share this video. And I did put up a donation for Alzheimer's disease. So if you want to donate to the cause, you definitely can do that as well too. So next Monday, Medical Monday, 8 p.m. from 8 to 9 on the Medical Monday page. Thank you so much for tuning in. I am Dr. Grace. Grace and peace. God bless. Bye for now.